Urinary incontinence is something many people live with, but few feel comfortable talking about. While it can feel embarrassing, it's actually very common and affects both men and women in ways that deeply impact daily life. To help break the stigma and learn a little bit more about treatment options, I sat down with a trauma and reconstructive urologist who specializes in helping men overcome bladder incontinence at Lexington Medical Center. Dr. Westbrook is joining me now in studio. Thank you so much for being here.
Absolutely. Thank you for having me. It's a pleasure.
Yeah. Okay. So what is urinary incontinence? If people aren't familiar with what that word means, what is that?
Sure. In broad terms, urinary incontinence is when you lose the ability to control your urine.
And there are different types of this as well. Can you kind of walk me through those?
Yeah, there's several types of urinary incontinence. So you have urge incontinence, which is where you get kind of a sudden urge sensation that you need to go to the bathroom now.
Okay.
And then on the way to the bathroom, you may leak urine on the way.
Okay.
So then you have overflow incontinence. That's where you're not emptying your bladder completely when you urinate. So urine kind of continues to build up, your bladder gets full, and then you leak urine because your bladder becomes overfilled.
Got it.
And
okay.
then you have stress incontinence. So stress incontinence is leakage with physical activity, again, like coughing, sneezing, exercising, or really any strain.
And would you consider urinary incontinence a normal part of aging?
So it is true that our pelvic muscles do weaken as we age, but incontinence is not a normal part of aging and should never be ignored.
Okay.
So kind of our job is to educate patients that incontinence should not disrupt your life and that we have a lot of treatments available that can help.
Let's talk about treatments.
Sure.
What treatment options are available? There's surgical and non-surgical, if I'm correct.
Correct.
Okay.
The treatments can include some lifestyle changes, pelvic floor physical therapy, which is a specialized form of physical therapy that focuses on strengthening the pelvic floor muscles that help to control your bladder. And then there's some medications we can offer, and then you can even treat it with surgery.
And what types of surgeries are available for urinary incontinence?
Yeah, so we offer 2 minimally invasive surgeries that help with male stress incontinence.
Okay.
The first one is the male sling. So this is ideal for patients who have a mild form of stress incontinence. So they leak with physical activity or with weightlifting or straining. So the male sling is a small piece of mesh that we put underneath the urethra so it acts like a hammock to kind of lift and support the urethra.
Okay.
So then the second procedure we offer is the artificial urinary sphincter. So this is the gold standard for treating moderate to severe stress incontinence. So it's an implantable device that we put in internally that mimics the function of the body's normal urinary sphincter. So men have total control over the device and can activate it when they need to use the restroom.
Well, thank you so much for being here and sharing this with us. And y'all, we're going to have all this information up on our website. And if you think you might be experiencing something like this is your sign to definitely go and check in with your primary care provider. Thank you again, doctor.
Thank you.